Hello, this is Cameron Sabat, a Georgetown third-year medical student with Cutting to the Case. Today I'm joined by Dr. Mark Vitale, and he is a board-certified orthopedic surgeon and fellowship-trained specialist in hand, wrist, and elbow surgery. He's also the chief of the Department of Orthopaedic Surgery at Greenwich Hospital and is widely renowned for his leadership in upper extremity care. So I guess we can start right now with the first kind of question I have, which is, as chief of orthopedic surgery at Greenwich Hospital, how do you balance administrative leadership with clinical innovation in patient care?
Oh, thanks, Cameron. It's really a totally different skill set. I took on that position as director of the department about 3-4 years ago, and like everything else, it takes a certain amount of time to learn sort of people skills, managing expectations, leading a group of different people with different personalities, functioning in various meetings, and it is basically sort of like a side gig in a way. It's a separate activity. It's very different than the field of hand surgery, and it's a fun thing that do aside from clinical practice and care, but it really uses a different part of my brain, so it's sort of fun to use a different skill set in my career.
Absolutely. And about those different skill sets, you're deeply involved in both adult upper extremity trauma and pediatrics. So what are the key differences in managing these populations, and how do you adapt your approach for younger patients?
One fun thing about hand surgery, I think, is you can take care of a 2-year-old, you can take care of a weekend warrior, you can take care of an elderly patient, and I'm in a community practice where I take care of a lot of families. So I may take care of several individuals in a family, and it is really fun because you communicate with a 6-year-old very differently than you might communicate with someone who's in their 60s, and as doctors, probably our most important skill is communication and relating to patients. And I think I would sort of be bored if I was only taking care of a very small population. Like my colleagues in joint replacement surgery, they do amazing work, but basically they take care of a very narrow population of people and do a narrow subset of sort of surgical procedures.
Yeah, absolutely. And really, that kind of specialization versus that generalization, it's a very interesting kind of perspective that you have there. So for medical students and residents, and this is my final question, I want to be respectful of your time, aspiring to follow in your footsteps, what core values or daily practices have most contributed to your success over time?
That's a great question. I think probably the most important thing is put your patients first. Always think about what's important for why your patient's there to see you. People take time out of their day and take time off from work because they're scared or they have a problem or they're in pain. And as long as you always remember that your job is to help someone and you're working as a team to sort of figure that out, then I think you're going to be successful.
Absolutely. So thank you so much, Dr. Vitale. And I'm Cameron Sabat, and this is Cutting to the Case, and I'm signing off. Thank you very much.